webinar that has been graciously sponsored by the 220 family of companies. My name is Tom Dumez. I am a certified HIPAA professional and certified security compliance specialist, and I am the president and the founder of Prime Compliance. And what I do at Prime Compliance is I teach people about HIPAA and high tech, and I perform risk assessments for both the business associate and the covered entity. A little background, I came from the records and information management world, spent 12 plus years in that industry, and so I've had the opportunity to see HIPAA and everything associated with HIPAA from opposite ends of the spectrum, if you will, both from the business associate and covered entity sides. So once again, I want to thank 220, the family of companies, for asking me to do this webinar. And this webinar is entitled HIPAA Privacy and Ebola Type Events. And one of my goals with this is to take a look, a more logical or practical look at HIPAA privacy, and then what appears to be some contradictions with public health issues. So out of the gate, this webinar is more practical or opinion or realistic than it is being approached from a legal or that kind of a standpoint. So we will get going with this, and as always at the end there will be an opportunity for question and answers. Okay, it doesn't want to work. Let's start with some definitions. We all talk and place a great deal of emphasis and importance on privacy. Well, here's what privacy is defined as. It's the quality or condition of being secluded from the presence or view of others. I understand that a number of the people that initially signed up for this were from the medical world, the covered entity side of HIPAA, and my experience just walking through hospitals or doctor's offices, either for my own appointments or to see other people, that hospitals generally, I don't mean this specifically perhaps to your organization, but generally do a pretty poor job of keeping most information private. Again, with this definition, there have been just too many times I see things I'm not supposed to see, which falls into the secluded from the presence or the view of others part of that definition. One of the other definitions is the state of being free from public attention or unsanctioned intrusion. This actually really is things that are being posted on websites, things that are being posted on social media such as Facebook or Twitter, and then unsanctioned intrusion, I relate that more to hacking. The unsanctioned intrusion or the hacking part, that really comes into play today because of the requirements to have electronic medical records. The Target attack, the Home Depot, JP Morgan, those were all unsanctioned intrusions. Those were done by hackers. So all the necessary safeguards, the technical safeguards really must be in place, at least in an effort to do your due diligence to prevent that from happening to the best of your ability. And then one of the other definitions is proper protection, which is confidentiality, privacy, and security, while still allowing the flow of PHI or protected health information in order to keep the flow of information going for healthcare payment, treatment, and operation. Here's what public health is defined as. This is the science and practice of protecting and improving the health of a community as by preventative medicine, health education, control of communicable diseases, application of sanitary measures, and monitoring of environmental hazards. Again, I put this in here because we're talking about a public health event, a potential crisis that took place not too long ago. Under the sharing of patient information slide, let's talk about healthcare treatment. under the privacy rule, covered entities may disclose, without the patient's authorization, protected health information about that patient as is necessary to treat the patient or to perhaps even treat a different patient. If it's determined that the public health is at risk, then they are allowed to, without a patient's authorization, release or disclose information. Treatment includes the coordination or management of health care and its related services by one or more healthcare provider and others, in consultation between providers and the referral of patients for treatment. Section 45 of the Code of the Federal Regulations, 164.502, and there are some other ones there. And then the definition of treatment is at 164.501. So to coordinate and manage health care and other related services that may be tied to a public health outbreak is allowed under the privacy rule. Here's what HIPAA privacy allows. It allows disclosure to a public health authority, such as the Centers for Disease Control and Prevention, or the CDC as we know it, or to a state and local health department that is authorized by law to collect or receive such information for the purpose of preventing or controlling either disease, injury, or disability. This would include, for example, the reporting of disease or injury, reporting vital events, such as births or deaths, provided they're still associated with some type of potential public health outbreak, and then conducting public health surveillance, investigations, and interventions. A public health authority is an agency or authority of the U.S. government, or a state, or a territory, or a political subdivision of a state or territory, or an Indian tribe that is responsible for public health matters as part of its official mandate, as well as a person or entity acting under a grant of authority, either from or under contract with a public health agency. As we know, every hospital that I'm aware of, whether it's privately or publicly held, has to fall under the authority of a public health agency. There are some references there to two different provisions of the Code of Federal Regulations that will authenticate this information. So, for example, a covered entity or a hospital or a doctor's office or a laboratory may disclose to the Centers for Disease Control the protected health information on an ongoing basis as needed to report all prior and prospective cases of patients exposed to or suspected or confirmed that had the Ebola virus disease. So in an effort to prevent this thing from spreading, they are in fact allowed, according to the privacy law, to communicate this and to share information that is private, secure, confidential with the public, which is where I see the contradiction happen. It also allows disclosure to family, friends, and others involved in an individual's care, and also for notification. The covered entity may share protected health information with the patient's family members, relatives, friends, or other persons identified by the patient, and that's key, as involved in the patient care. Covered entity also may share information about a patient as they deem necessary to identify, locate, and notify family members or guardians or anyone else responsible for that individual's care of the patient's location, general condition, or death. One of the key provisions in the privacy rule is that even the fact that a patient is or that a person is a patient at a facility is protected health information, and it cannot be disclosed. So, again, going back to doctors' offices or smaller practices, even today, many times, doctors' offices have their patients, when they come into the office for their appointment, they sign in and they put today's date. Well, what that does, that identifies to anybody coming in, if this is me going into a doctor's office, it identifies me as a patient at this facility which is protected health information, by the way, and they're not allowed to share that. But everybody who comes in after me now knows I'm a patient at this facility. This can be problematic, especially if it's an oncology practice. Everybody on that list that has signed in as a patient that day, they are telling, the oncologist is telling everyone that each one of these individuals have cancer. Again, that's a violation of HIPAA, but yet when it comes to public health, they can release the patient's location or the hospital this individual is at. We saw this happen with the individuals in Dallas when the Ebola thing first happened, and again, that's where I see the contradiction. Back to the slide. This may include, where necessary, to notify family members and others, the police, the press, or the public at large. And again, there's a code of federal regulations reference in there. The covered entity should get verbal permission from individuals or otherwise be able to reasonably infer that the patient does not object when possible. Again, I want to stop here. Let's talk about those folks whose names and faces were plastered all over the news for Ebola. And just for the record, as it turns out, that Ebola outbreak never really happened. There were some cases of Ebola. I don't know if the public health departments or the CDC, I don't know if them announcing this Ebola actually prevented it from spreading. But it really didn't turn into a public health concern, even though they, if you do go to a medical facility, they will ask you if you've been in a West African country in the last 21 days. So I'm not quite sure where the Ebola scare, how that really happened, because there's only really a few individuals that got the Ebola, which I guess is a good thing. If the individual is incapacitated or not available, covered entities may share information for these purposes if, in their professional judgment, is doing so in the patient's best interest. So even though right after that reference to the Code of Federal Regulations, it says the covered entity should get verbal permission from individuals, they don't necessarily have to, provided they can, in their professional judgment, determine that doing so is in the patient's best interest. Again, my opinion, my medical condition is always in my best interest. I'm not sure I want someone determining in their professional judgment what my best interest is, but that's just my personal opinion. In addition, the covered entity may share PHI with disaster relief organizations that, like the Red Cross, are authorized by law or by their charters to assist in disaster relief efforts, provided the purpose of coordinating, or the purpose is to coordinate the notification of family members or other persons involved in care, patient's location, general conditions. So it is unnecessary to obtain a patient's permission to share the information in this situation if doing so would interfere with the organization's ability to respond to the emergency. So in cases where big hurricanes, for example, or a fire at a chemical plant where there could be some airborne chemicals or things that are damaging, then the Red Cross and disaster relief organizations, in an effort to employ those or to protect the volunteers or their employees or the public, then they can, by law, they can pretty much release whatever information they deem necessary. I think that's a good thing, and not something I've got hung up on. It also allows these items, the imminent danger, the healthcare provider may share PHI with anyone as necessary to prevent or lessen a serious and imminent threat to the health and safety of a person or the public. And under the imminent danger, this may very well be why the Ebola quote-unquote outbreak really never amounted to an outbreak. If it was determined to be an imminent threat, which it was, then the measures were put into place to prevent it from spreading. That's a good thing. Disclosure to media or others not involved in the care of the patient or the notification. Upon request for information about a particular patient by name, a hospital or other health care facility may release limited the facility directory information to acknowledge an individual as a patient at the facility, and then provide basic information about that patient's condition. So HIPAA says they cannot do that. They must protect the fact that someone is a patient at a facility, although most do not. Anybody can go ask what room someone is in, and they will normally be given the answer. And for law enforcement and things of that nature, of course, it's totally acceptable. But here's, again, it's another contradiction within HIPAA. And then some of the examples of the patient's condition are critical or stable or deceased or treated and released if the patient has not objected. So that's the key part. Again, you need the patient permission in most cases, as you do with most things in HIPAA, except if the patient is incapacitated, if the disclosure is believed to be in the best interest of the patient and or the public, then they're allowed to do this. So in general, except in the limited circumstances described elsewhere in this bulletin, and this bulletin is I'll be happy to provide that bulletin to anybody who would like it. Affirmative reporting to the media or to the public at large about an identifiable patient or the disclosure to the public or media of specific information about treatment of an identifiable patient, such as past lab results, test results, or details of a patient illness, may not be done without the patient's written authorization or the written authorization of a personal representative who is personally legally authorized to make healthcare decisions. So in spite of everything, the patient still needs to give authorization. That's just the best practice that I would encourage any medical entity to do always, and in spite of whether it's a public health, a potential public health outbreak or not. Again, at the end of the day, what you do with someone's information needs to be handled in certain ways, but it needs to be handled in certain ways consistently with your policies and procedures, inclusive of a public health outbreak. And again, that's a contradiction to the entity being able to just give out as much information or the kind of information they deem, in their professional opinion, is necessary. And then you can reference the 45 CFR 164.508 for those requirements for a HIPAA authorization form. What HIPAA privacy does not allow is the sharing of more than minimum necessary. So in all cases, public health outbreak or not, or potential public health outbreak, you can only share the minimum necessary. I recall during the initial phases of the Ebola scare seeing a gentleman's picture on the news, his name, his age, where he was at, and which hospital he was at. Again, in my opinion, the picture was not necessary, the name was not necessary, and the age was not necessarily. It had no impact on Ebola whatsoever, but yet his complete identity and his condition was revealed when it really didn't have to be. They could have said a male in his 50s has been detained or quarantined for this potential virus, but they being the hospital shared it, so the media posted it. So again, you just have to be careful. HIPAA privacy does not allow the sharing with the public by either covered entities or business associates. I know there are exceptions to this with the public health outbreak kind of situation, but again, I would err on the side of consistently following your policies and procedures, and that those policies and procedures include the public health outbreak situation if it were to happen at your facility. HIPAA privacy does not allow the sharing of PHI or with any PHI with any unauthorized individual. This is where the permission slip really needs to be in place with the healthcare provider and the patient. There's a big thing going on in the news right now. Well, it's not a big thing, but in the circles that I follow, because HIPAA's kind of my world, where there's a pediatrician who was recently fined, and I forget the amount of money, but I think it was in excess of $20,000, because this pediatrician had a picture board in his lobby of all the newborns that he has delivered over the past X amount of years. Okay? Typically what they have on those are the picture of the baby, the name of the baby, the birth date, the birth weight, and the length. Dentist office oftentimes have a picture board in their lobby, especially if they have a large customer base of children, that just shows the picture of the child and the name, and every time that child comes in and has an examination with no cavities, the child actually gets to put a gold star in their picture. Well, that's a HIPAA violation. So you can't do that anymore, even though I agree it's ridiculous. However, you're posting that stuff in a public place. Anybody that walks into your office can see that Jane Smith is a patient, or that Jane Smith was just born. You really have to protect that, and the Office of Civil Rights is now starting to assess fines and penalties for those who fail to comply. So even in spite of these things that HIPAA privacy does not allow, if certain people or certain entities decide to share it, it then becomes okay if put under this category of a public health or potential public health outbreak. And again, I want to go back to Ebola. As serious as the effects of Ebola, the symptoms and everything of Ebola may be, it never turned into a public health outbreak. Yeah, there were some people that got infected by it, but it was pretty well contained. So I don't know if it was contained because it was announced so much and that these people's privacy was violated, or if it was just contained because it wasn't as difficult to contain as somebody thought. There are medical types that I'm sure will listen to this that are way smarter than I am. I'd love to get an email from you explaining this a little more in depth to me, just so I get a better understanding of it and perhaps change my opinion. I'm always open to that. And the different requirements of sharing or not sharing, either way, do not seem really airtight to me. So once again, I just want to encourage everybody to just follow your policies and procedures, and if they don't address this kind of thing, then I think it would beg discussion with privacy officers or CISOs or whoever at your organization is in charge of privacy, security, and confidentiality. What can a person do? That's very simple. Avoid getting anything that might be deemed a public outbreak or a communicable disease or condition. And I know that's ridiculous, but that's the best thing you can do is avoid getting these things. Stay healthy. I don't mean to say stay health. Stay away from sick people even when you have no idea that they might be sick. So I know those are kind of making light of the situation, and I don't mean to make light of these type of sicknesses, but really those are the best things a person can do by themselves. However, the bigger problem that I see lies within the entities that these people who would get sick, they go for treatment, and then before you know it, their information is all over the 6 o'clock news. Now, is this whole thing really necessary, all this notification, the public display of protected health information in spite of the rules? I really do think in certain situations it certainly is necessary. And again, going back to Ebola, it really didn't turn into anything major, which is a great thing. But back in throughout history, there have been illnesses that have literally plagued entire countries where huge chunks of their population ended up deceased as a result of a public health thing. So I do think in certain situations it certainly is necessary. But once again, who knows what will turn into a real public outbreak? And they err on the side of caution, they being the necessary departments involved in making these decisions. They err on the side of caution, which is likely good for everyone except the individuals who got whatever it was initially. Again, those Ebola patients, their names, ages, where they were, all that stuff was deemed to be necessary to disclose, at least by someone. Here's the criteria, and I think this is important to keep in mind. An epidemic is when an infectious disease spreads rapidly to many people, such as the SARS virus back in 2003, which took 800 lives. I don't know this for certain, but my guess is those 800 individuals that this virus took the lives of, not likely they all lived in one place. It was likely widespread, logistically. And then a pandemic is a global outbreak, such as Hong Kong flu in 1968, which took 1 million lives. So the entities or the departments that have to decide this, it depends whether an event is deemed to be an epidemic or a pandemic. If it's an epidemic, the public health officials on a local and state level, the Center for Disease Control, the Department of Health and Human Services, Department of Homeland Security, American Medical Association, and more. Those kinds of departments are, their involvement is critical. And then along with all of those above, for a pandemic, the World Health Organization, they also have tremendous input. Well, that's that. It was kind of quick, kind of painless. My goal with this is to just get people to think a little bit outside the box. And again, this stuff here that I presented today is way more from the practical standpoint or an opinion-based standpoint than it is from a truly factual standpoint. But as I suggested earlier, my email is right there, as well as my phone number. Email seems to be the best way to get a hold of me. I would love to hear any rebuttals of any of my opinions, just in an effort for me to learn more. So I want to thank, once again, the 220 family of companies for allowing me to do this. I look forward to doing more in the future. And again, thank you for listening to this webinar. And I hope that you will keep an eye on the 220 family of companies blog and website for their future webinars in an effort to help you become educated in topics that matter to you. Thanks once again, and I look forward to hearing from you.